Welcome to Healthy Care, the channel that shares valuable knowledge to help you take care of your health comprehensively. Coffee, a beloved beverage worldwide, provides alertness and a surge of energy every day. But have you ever wondered how your favorite cup of coffee might impact your liver? The vital organ responsible for detoxifying and protecting your body from harmful substances. The liver plays an irreplaceable role in metabolizing compounds from coffee, but if not consumed properly, seemingly harmless habits could unintentionally burden your liver's health. In this video, we'll explore the connection between coffee and the liver, and uncover smart ways to enjoy coffee to maximize its benefits while protecting your liver from adverse effects. Let's dive in with Healthy Care and learn more about your liver's health. Unstress on the liver from excess coffee. The liver serves as the central processor for caffeine and other complex compounds in coffee. Caffeine is primarily metabolized through the cytochrome P451A2 enzyme in the liver. When coffee consumption exceeds 4 to 5 cups per day, the accumulated caffeine becomes a significant burden for the liver. This forces the liver to work continuously, leading to stress and reduced detoxification efficiency. Moreover, excessive coffee intake can increase liver enzymes alt-alanine aminotransferase and ast-aspartate aminotransferase, two key markers indicating liver cell damage. While moderate coffee consumption can offer health benefits, overconsumption can lead to biochemical imbalances, making it harder for the liver to perform other functions such as metabolizing fats and eliminating toxins. A study published in Liver International revealed that excessive caffeine intake could reduce the activity of glutathione, a crucial antioxidant that protects the liver from oxidative damage. To reduce the strain on the liver, experts recommend not exceeding 400 mg of caffeine daily, equivalent to 3 to 4 standard cups of coffee. Listen to your body and gradually reduce intake if you notice signs of fatigue or discomfort. 2 toxins from low-quality coffee. Another concerning issue is the risk of toxins from low-quality coffee. Poor quality coffee may contain impurities like mold mycotoxins, a group of harmful compounds that can cause significant liver damage when accumulated over time. According to the World Health Organization, molds such as Aspergillus flavus and Aspergillus parasiticus often develop in improperly stored coffee beans, especially in humid conditions. These toxins not only damage liver cells but also weaken the organ's detoxification abilities. Additionally, low-quality coffee may harbor pesticide residues and preservatives. A study in the Journal of Agricultural and Food Chemistry found that around 20% of commercially tested coffee samples contained at least one chemical above safe limits. These substances can burden the liver and increase the risk of chronic liver conditions such as inflammation or scarring. To protect your liver's health, opt for clean, organic coffee. Organic coffee is typically grown without pesticides or harmful chemicals and is certified by international organizations like USDA Organic or Rainforest Alliance. Proper storage is equally important. Coffee beans should be kept in airtight containers, away from direct sunlight and high humidity, to prevent mold growth. Freshly ground coffee is also recommended for the best quality and flavor. A safe cup of coffee not only brings full enjoyment but also reduces liver stress, contributing to overall health. 3. Coffee and risk of fatty liver. When consumed moderately, coffee can provide numerous health benefits, particularly in supporting liver function. However, excessive coffee consumption, combined with an unhealthy lifestyle, increases the risk of developing non-alcoholic fatty liver disease (NAFLD). This condition occurs when fat accumulates in the liver beyond 5% of its weight, often due to a diet high in fat, lack of physical activity, and sedentary habits. Caffeine in coffee can stimulate fat metabolism and support liver function when consumed in reasonable amounts. However, a study in hepatology showed that excessive coffee intake paired with a diet high in saturated fats significantly increased fat accumulation in the liver. This condition becomes more severe in those who are physically inactive, reducing the body's ability to metabolize energy effectively. This imbalance can lead to chronic liver inflammation and long-term damage. To reduce the risk of fatty liver, a balanced lifestyle is crucial. Combine coffee consumption with a healthy diet rich in fiber, vegetables, and lean proteins, while limiting fried or processed foods. A study published in the Journal of Nutrition found that maintaining moderate coffee habits 2 to 3 cups per day and engaging in 150 minutes of exercise per week could significantly lower the risk of developing fatty liver. Additionally, weight management and maintaining a healthy BMI are essential for protecting liver health. 4. Elevated liver enzymes in sensitive individuals. Not everyone reacts to caffeine in the same way. Some individuals sensitive to this compound may experience elevated liver enzymes, indicating mild liver damage or inflammation. Liver enzymes, including alt-alanine aminotransferase and ast-aspartate aminotransferase, are released when the liver sustains damage. Elevated levels of these enzymes can signal impaired liver function. A study in clinical gastroenterology and hepatology found that 5 to 10% of coffee consumers might experience enzyme elevation, particularly those with the CYP1A2 gene variation responsible for metabolizing caffeine. These individuals may exhibit symptoms like fatigue, bloating, or mild pain in the upper right abdomen, along with elevated liver enzyme levels on blood tests. Early detection of elevated liver enzymes through regular blood tests is crucial. If abnormalities are detected, reducing coffee intake or switching to low-caffeine coffee can help manage the condition. Experts recommend that sensitive individuals limit coffee to less than 200 mg of caffeine per day, equivalent to 1 to 2 standard cups. Additionally, incorporating antioxidant-rich foods like turmeric, green tea, and vitamin C-rich fruits can support liver recovery. A balanced lifestyle, including sufficient sleep and stress management, is vital in minimizing liver damage risks and enhancing the organ's natural detoxification functions. With appropriate adjustments, you can enjoy your coffee habit while protecting your liver's health effectively. 5. Hormone imbalance and liver strain. Coffee contains bioactive compounds, including phytoestrogens, natural compounds that mimic estrogen activity in the body. These, along with caffeine metabolites, can affect hormone balance, especially in women. The liver plays a crucial role in regulating hormones by metabolizing and eliminating excess hormones. consuming large amounts of coffee forces the liver to work harder to maintain hormonal stability, increasing the organ's workload. This effect is more pronounced in women during menstruation or menopause, when natural hormone fluctuations make the body more sensitive. A study in the American Journal of Clinical Nutrition found that women consuming over 300 mg of caffeine daily, about 3 cups of coffee, exhibited greater estrogen fluctuations than those who consumed little or no caffeine. This may lead to symptoms such as menstrual irregularities, stress, or discomfort. To mitigate these negative effects, reduce coffee consumption during sensitive phases and opt for low-caffeine coffee varieties. Additionally, a diet high in fiber from vegetables, flax seeds, and legumes can help the liver efficiently metabolize hormones. Drinking plenty of water also supports optimal liver function by reducing the buildup of metabolic byproducts. 6. Oxidative stress and liver damage. Caffeine and various compounds in coffee can stimulate free radical production, leading to oxidative stress, a major cause of liver cell damage. Oxidative stress occurs when the balance between free radicals and antioxidants in the body is disrupted, resulting in damage to cell membranes, proteins, and DNA within the liver. A study in free radical biology and medicine revealed that high caffeine intake significantly increased free radical levels in the bloodstream, placing additional pressure on the liver to neutralize them. The liver has a natural antioxidant defense mechanism, utilizing enzymes like glutathione peroxidase and superoxide dismutase to protect cells from oxidative stress. However, when free radical levels exceed the body's capacity, liver cells may sustain damage, potentially leading to inflammation or chronic conditions. Oxidative stress is also a significant risk factor for developing liver fibrosis and fatty liver disease. A diet rich in antioxidants is essential to reduce these risks. Foods like berries, spinach, walnuts, and green tea can help the body neutralize free radicals more effectively. A study in the Journal of Nutrition found that consuming at least 300 mg of antioxidants daily could reduce oxidative stress in the liver by up to 20%. Additionally, incorporating antioxidant vitamins like vitamin C and E can enhance liver health and protect cells from damage. Balance coffee consumption with a nutrient-dense diet to safeguard your liver and ensure long-term health. 7. Coffee's impact on sleep and recovery. Sleep is a golden period for the liver to regenerate and recover naturally. However, drinking coffee in the evening or consuming too much caffeine throughout the day can disrupt sleep, reducing the quality of deep sleep, the most crucial stage for liver recovery. Caffeine, with a half-life of 3 to 7 hours, can remain in the body throughout the evening if consumed close to bedtime. A study published in the Journal of Clinical Sleep Medicine found that drinking coffee within 6 hours of sleep could reduce deep sleep duration by up to 20%. Deep sleep is essential for the liver to eliminate toxins and activate the production of glutathione, a powerful antioxidant that protects liver cells from damage. Sleep deprivation or disrupted sleep can impair liver function, increase toxin buildup, and lead to chronic conditions such as fatty liver or fibrosis. Moreover, poor sleep affects energy metabolism and hormone regulation, causing fatigue and reduced immunity. To ensure sleep is not affected, carefully plan your coffee intake. Experts recommend avoiding coffee consumption after 2 to 3 p.m., especially for individuals sensitive to caffeine. If you still crave coffee in the afternoon, consider decaffeinated options to prevent sleep disruption. Additionally, establish a consistent sleep routine and avoid other stimulants to give your liver the best chance to recover optimally overnight. 8. Insulin resistance and liver function. Caffeine in coffee, while offering numerous health benefits in moderation, can reduce insulin sensitivity in some individuals, especially when consumed in high doses. Insulin is a hormone responsible for regulating blood sugar levels, and the liver plays a vital role in metabolizing glucose to provide energy. When insulin sensitivity decreases, the body needs to produce more insulin to manage blood sugar, leading to insulin resistance. A major risk factor for type 2 diabetes and metabolic disorders in the liver, including non-alcoholic fatty liver disease (NAFLD). A study published in the American Journal of Clinical Nutrition found that consuming more than 600 mg of caffeine daily could reduce insulin sensitivity by up to 15%. In some individuals, particularly those with a history of insulin resistance or diabetes, this condition not only puts stress on the liver in processing glucose but also disrupts the mechanisms of storing and distributing energy, leading to fat accumulation in the liver and an increased risk of inflammation. To mitigate these risks, managing sugar intake in your diet is crucial. Avoid adding sugar to coffee, especially syrups in commercial coffee beverages, to reduce the metabolic load on your liver. Instead, opt for natural sweeteners like stevia if needed. Additionally, avoid drinking coffee on an empty stomach, as it can cause a sudden spike in glucose and insulin levels. For individuals with metabolic issues, pair coffee with meals rich in fiber and protein to stabilize blood sugar levels and minimize caffeine's impact on liver function. A healthy lifestyle, including a balanced diet, regular exercise, and routine monitoring of blood glucose and liver function, is key to maintaining long-term health. When consumed appropriately and in moderation, coffee can remain a beloved beverage and a part of a health-supporting lifestyle. 9. Acrylamide risks from coffee roasting. Acrylamide is a chemical compound that naturally forms during the coffee bean roasting process, particularly at high temperatures. It is a byproduct of the Maillard reaction, which gives coffee its characteristic color and flavor. However, acrylamide has been classified by the International Agency for Research on Cancer (IARC) as a potential carcinogen group 2A when consumed or exposed to over prolonged periods. In addition to cancer risks, acrylamide accumulation in the body also places significant strain on the liver, which is responsible for metabolizing and eliminating this chemical. A study published in Food and Chemical Toxicology found that acrylamide could cause oxidative stress in liver cells, impairing the liver's ability to regenerate and detoxify naturally. The amount of acrylamide in coffee depends on the roasting process, with dark roasted coffee generally containing higher levels than light roasted coffee. This presents a challenge for those who enjoy bold coffee flavors but are concerned about their health. To reduce this risk, Opt for light roasted coffee or brands certified for controlled acrylamide levels during production. Brewing methods also influence the level of exposure to this compound. Methods such as paper-filtered brewing can help lower acrylamide content in your final cup. Additionally, consuming coffee in moderation, no more than 3 to 4 cups per day, and pairing it with an antioxidant-rich diet, such as fruits and vegetables, can help your body counteract the harmful effects of acrylamide. 10 negative interactions with liver medications. Coffee is not just a popular beverage but also contains numerous chemical compounds that may interact with liver medications. One of the key components in coffee, caffeine, is metabolized by the liver through the enzyme cytochrome P450 CYP1A2. Drinking coffee can affect how medications are processed in the liver, reducing their effectiveness or increasing the risk of side effects. For example, non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen, or cholesterol-lowering statins like atorvastatin may be impacted when consumed alongside large amounts of coffee. A study published in the European Journal of Clinical Pharmacology demonstrated that caffeine could slow the metabolism of certain medications, causing them to remain in the body longer and increasing the risk of liver damage. Additionally, polyphenols in coffee, while beneficial in moderation, can interfere with drug absorption or efficacy. This is particularly relevant for patients taking anti-inflammatory drugs, immunosuppressants, or treatments for viral hepatitis. To avoid negative interactions, consult your doctor about your coffee habits when starting or adjusting a treatment plan. Healthcare professionals often recommend avoiding coffee within 2 to 3 hours before or after taking medications to minimize interaction risks. Regular liver function tests and close monitoring of unusual symptoms can also ensure safety during treatment. With a mindful balance between coffee consumption and medical guidance, you can enjoy the benefits of both without compromising liver health. Your liver is the silent hero protecting your health every day, and how you consume coffee can directly impact this vital organ. Remember, a properly enjoyed cup of coffee can keep you alert and contribute to overall health when consumed responsibly. Listen to your body and always prioritize smart choices for your well-being. If you found this video helpful, don't forget to hit the like button, share it to spread knowledge, and subscribe to Healthy Care to stay updated on more valuable health content. Let's build a community of healthy, knowledgeable, and energetic individuals together. See you in the next video.